Okay. With that, I'm going to turn it over to Commissioner Schnell and also Safi, you want to introduce?
Yeah, I'm Safi Hassan. I'm the Government and Partner Relations Director. I'm just joining in and taking notes, and will help answer some questions if Commissioner doesn't have the information right on hand.
All right. Good afternoon, everyone. Thank you for joining. I'm just going to cover kind of some of the things that have been put in place and that are underway. As you know, last Friday, a week ago today, it seems like it's been a month, but the governor issued the emergency order declaring a peacetime emergency. As a result of that, it created a number of different triggers for the state. Even though we had been working closely on our pandemic plan since early parts of February, when we began to see what was happening in China and the spread there, we began to work on that plan. Early last week, we stood up and directed the stand-up of the DOC's incident management team to put in place kind of how we implement all of the things that we want to try and do. Part of that is that we provided to people some direction to our staff around leadership intent. And I bring this up only because I think it's important, because I think it lays a framework for how we're thinking about this. And really the leadership intent in the response to this and the priorities. And again, this is within the given framework that we have and our legal responsibility and authority is to ensure the safety of people. And that includes making sure that we don't just respond by locking these facilities down and trying to just control and contain this by warehousing people more than we could probably all argue that people are. And so I think what we really endeavored to do was to say that we valued the fact that we wanted to keep people safe to the extent that any of us can truly be safe in that type of an environment, and do that without using draconian measures to further control people and not give people access to phones and showers and recreation and education and the opportunity to work for those who choose to do that and those sorts of things. And so that has been one of the objectives. Early on, we identified some of the priorities as we did issue and deliver soap to everybody, and just the hand soap. It was not a ton. That stuff is available to people. We began to put out some information and stepped up the frequency of the unit councils. We've directed the wardens to be communicating with unit councils on at least twice weekly basis. We've also provided some direct communications to the incarcerated folks, just so that they are aware. We're working to put together, and we just have been finalizing some of the language for this. Probably won't go until Monday, but a video to the incarcerated folks, and we're also working on a video that will be available publicly for people, for family and loved ones of those who are incarcerated. There's been a tremendous amount of demand. We stopped visiting, as you saw, and that we know that it's not an easy decision for anybody, much less us. We know that means a ton to people inside. We also restricted volunteers from access, and so that means that some of the volunteer-based programming is no longer going. But we did say that we were going to work to make sure that education stuff and these other programs remain active. We put in place screening of employees as they enter the facilities, and really all of our offices, even at central office, everybody gets screened coming in. We waived medical co-pays on all medical visits out of a desire to make sure that people felt like they could come forward and not have to worry if money was an issue in terms of reporting a concern. We reached out to our vendors and we were able to secure 2 free phone calls per week for folks. They're 5 minutes, they're limited, but that was a starting point. We have also begun the process and really have prepared a COVID-19 related budget that just to be honest, totally frank, I just don't know what's going to happen with some of this stuff, given the demands on the state and the legislature. That's something that's going to have to be there. That would, if it got funded, we would really be opening up phone calls and dramatically expanding the ability and options around video visits. So those have been, many of the things we put in place. Hand washing stations have gone in. We've increased the number of stations for people to access hand sanitizers. They're doing movement. In the discussions I've had with the wardens, they said that, in the conversations with people inside, they said that, they really didn't, they certainly preferred to have the facility as open as possible in terms of, being able to get out of the housing units, to be on the flag, to be out in the yard, and those sorts of things. And so that was one of the priorities. We also we intend to kind of put out to folks that if somebody feels like they want to act in their interest around health, that if they say, look, I'm not going to work, I'm going to discontinue working until this crisis is over, they would not lose their position. Now that said, I can't. We're also being clear about the fact you can't decide I'm not going to work today, but I will tomorrow. And it's not a day thing. It's going to be. It's really if you would prefer for your own safety and health and well-being to kind of shelter yourself. We certainly don't want to stop that, and we don't want people to feel like they're being harmed by that in terms of a loss of an opportunity later on.
Hey, Commissioner, don't you think that disincentivizes people from actually not? I'm sorry, this is Elijah Darris with the ACLU. Don't you think a policy like that would disincentivize people from actually not working if they're not feeling comfortable, if they think that they would not be able to return to work for the duration of this? What if they wanted to return to work 2 weeks from that point?
I mean, I think the question really becomes, I think what we're trying to avoid is, I'm going to sleep in today, I'm going to come back tomorrow. I think what we're looking for people to make some, and again, if conditions change, certainly, I did a 2-week kind of hiatus of self-sheltering and I feel confident going back. That's a different thing than changing every day. I think that the intent is just not to have people use it as a flip-flopping thing. But if somebody said, look, I'm going to do 14 days where I'm not going to do it, so I can self-shelter or do whatever their rationale is, that's totally fine.
Yeah, could that just be the articulated policy, just so that people can have an idea of in 14 more days they can reassess and make another decision? Otherwise, my concern is that people are going to be so concerned, with regard to well, when will this end? Will it be 2 months? Will it be that they just won't take care of themselves and keep the population safe?
Yeah, that's fine. We can do that. So that those, I think those are probably many of the main things that are happening. We have implemented our COOP plan, our contingent of operations plan, because we understand that we have to be able to provide at every level, and so we want to make sure our food service stuff is we have both the ability to serve the people and have contingency plans in the event that we have sickness among food service workers or staff or whatever it may be. So we have contingency plans that are put in place to address all of those things. We have worked with our medical staff, both nurses as well as our contract providers, and have put in place contingency plans for expansion of areas within facilities for purposes of kind of medical containment or quarantine. I'm happy to report that we have tested a number of people, I think 4. All of those tests have come back negative. That's with some peace of mind.
Can I ask a question there, Commissioner? I know for people outside of prison, the concern is having enough tests. What's the availability of tests for?
So we met with availability is still pressured really across the country, and that's a supply chain thing. Now, the governor did make some arrangements and have conversations with Mayo Clinic, who has developed a test that is now being accepted and used. MDH and Mayo will be working together. Yesterday they had a big day in terms of they ran about 800, which is the biggest number they've run in a day. I will also just tell you that that people who are in congregate living settings, including prisons, are higher priority. And just so you know, it's not the highest, but because hospitalized patients, people who are hospitalized are number 1. And so they focus on those tests first. Now, this will dramatically change as test reagent becomes more available across the country. They will test at significantly higher rates, and we should be turning these things very quickly.
That's good. Commissioner, may I interrupt you? This is Sharon Brooks Green, checking in. I wanted to, you said that there were 4 tested already. Of those 4, and just thinking proactively in response to what happened in Wisconsin, where one security guard, there been one who did test positive for such a negative, response.
You kind of broke up, Sharon. I didn't catch all of it.
I just wanted to know, Commissioner, in response to the Wisconsin prison, where one guard did test positive, do we have a plan in place for such results?
Yeah. So if we hope our screening will help. Now, again, we know that screening is not 100. There's no 100%, but we hope that helps. We have sent a number of staff home. In fact, in some cases, a considerable number of people went home because they answered questions, and from a screening standpoint, we're going to act out of an abundance of caution, and we're sending people home, even though they didn't have full kind of symptoms and that kind of stuff. But we sent them home. So that is our process. Obviously, if there would be, a staff all of a sudden was tested positive and they had worked yesterday, we would again go back and look just like what's happening in the community and look at what kind of contacts there have been and those sorts of things. And we know that we have people who have had contact outside, and probably many of us may have had contact with people who maybe have COVID, but because testing is so limited, we may not even know it.
And based on our previous conversations, Commissioner, it sounds like so if an inmate tests positive, you would quarantine them, and then the living unit may have some restrictions.
So,
the facility wouldn't necessarily be shut down.
I think really what we're doing right now is, let's say that you had a cellmate. What may happen is if somebody presented with symptoms that would be consistent with COVID-19, first thing that they're going to do is, just so you know, is they're going to test them for influenza A, because we've had a lot of influenza A. So we test for influenza A, and we had one the other day, I can't remember exactly which, maybe Stillwater, and they ran that test, and it was influenza A. And so, they followed the standard flu protocols in that case. And then if they test negative for influenza A, then that person is going to be put in medical kind of medical containment, and that and then we may quarantine or restrict the movement of people who are immediately around them until we get a test result back. Because the last thing we want to do is have a massive spread. And I think when we met with the state epidemiologist and we sat and talked about things like, let's assume we had one housing unit at Stillwater or wherever that we lost from when I say lost, that became sick, or there was a large scale infection. Do they believe that we could contain it to that, or would is it likely that the spread would be facility wide? And they do believe, based on what they're seeing around the country, even on some of the cruise ship stuff, that where there was separation, even though may not have been significant levels of separation, that it did result in containment. So I say that only because we want people to know that we have been really reaching out to people to try and get a sense of how we do this. We've also talked to people, other commissioners and DOC secretaries from around the country, just to make sure that what we're doing is in keeping and with kind of the best practices that we know of around the country. And so, other kind of questions people have?
Yeah.
Well,
Thank you, Commissioner. This is Devika from Release Minnesota 8. Thank you for sharing that piece about separation and best practices. I really appreciate sharing all the thoughtfulness and intention that's going into this. I'm just curious, obviously one of the most common sense best practices we're seeing around the country now is actually release of folks that are inside. And I'm wondering, how much you all are considering that and where you are in that conversation.
So the places that becomes easiest, just to be frank, and where we're seeing it really across the country, in some states on a very limited basis, but has been in the county jails. And I think some of that, the issues of release around pretrial. In some cases, it could be reviewing people's status and releasing people on personal recognizance and those sorts of things, which courts can order. There is some challenges here around sentencing orders and the fact that they are on a sentence that we have limited authority to just exercise broad-based release of people. We looked at conditional medical release and have had some legal opinions on that. We've identified the folks that we know to be of highest risk. And the one thing I would just say is that the law, and some may argue this, but the law, as it's read, really does not allow for proactive release because of a public safety issue or public health risk to people. And then I think we also have concern, and I know this doesn't feel good, and I don't really feel good about even saying it, but it is the reality that assuming as we start to look at, and every day we have meetings with the governor and the Department of Health and all that kind of stuff, we're hearing about bed space and critical care, the availability of even community-based care, and the concern about what a system that could become even more overtaxed. The last thing we want to do is put people in a place where it's going to be even more difficult to get access to care. So, and that doesn't feel good when you're comparing prison care with community care. But I think we have to look at the fact that community care may not be what it is and what we've known it to be during a crisis like this.
What about release violations?
Release violations. So the two things that we really have been focusing heavily on, and the place we've really focus was early this week, on Monday morning, I think it was Monday or last, I can't remember, but I think it was Monday. We had all of the county Community Corrections Act directors and the DOC supervisors and probation managers. We had met last Friday with the hearing and release unit. We put in place a directive that they utilize danger and danger considerations for the issuance of warrants, and apply those standards to hearings. And I can tell you, I don't know the exact numbers. Somebody has them; they were pulling them, but the numbers are down, and we're seeing that also on the probation front. And remember that it's not just about DOC; it's about the jails. The jails are really putting pressure back to say they want to reduce population, and we want to reduce population. So even probation violations coming back, people out of court to if they're going to order to serve jail time, or are the number of sentences being executed to the DOC are also down.
That's really good news. However, Commissioner, has any probation technical violators been released from the prisons?
No, not at this point in time. We are working on those plans. I have asked HRU to provide the reentry unit with a list of all the people who are in on release violations, and first, just those people who are in and have returns with an or less provision. So sometimes people come back and they may have 120 days or less as part of a sanctioning or a consequence response. And so I've asked for a list of all the people who came in with those types of provisions, and those are being reviewed by the reentry unit, and we're looking at what release plans they have, and with an effort to try and move people out in those cases. We're also looking at some of the people who are closest to release, and looking at the possibility of expanded work release. Some of this becomes a resource issue because we have to be able to manage that. There's and so we are working a plan in an effort to try and look at people who are deemed lower risk and are within 120 days or whatever. We're looking at a number of different demarcation points and saying what would it take to be able to provide some level of relief that is within DOC authority, but there is also even things like work relief. There is statutory language that does require certain provisions be put in place. So we have to make sure we're meeting the statutory responsibility, because we do not have the authority to do anything outside of what the statute provides us to, allows us to do.
Hey, I wanted to bring up really quickly about the medical relief that has been looked at for the pregnant women at Shakopee right now.
Yeah.
And I know that we have over 6 women that are currently pregnant with referrals, and we know that there's not right now. I know that you guys have been working to try to get some of the women out, and I just wanted to bring attention to one fact. There's one woman that's being that's delivering on Monday, and because the facility did not make it a priority to get her an appointment out in the community, she's now not able to be out in the community and have that baby on Monday, because we were told that she needed to have at least one outside facility medical visit, and now because they didn't make an appointment, and we called ourselves to make sure that there was availability, and they said that there's absolutely availability, and now because the facility didn't take those steps that they needed to take, she is going to be birthing on Monday, And again, coming back with the risk after going into the hospital, being exposed, going back to the facility immediately after the birth. So is there some more things that you could be pushing out towards these facilities to understand that like this is a prime time, understanding that everybody has a lot of other things going on too, but when we're talking about, not knowing the risk for pregnant women or not knowing the risk of being at these hospitals where people who, most likely have been exposed are going back.
Yeah, can we connect on this one afterward? Because if there's something I can do to intervene, I'd like to at least try to do that. So
absolutely.
We are working on, we do have a contract in place. We have stuff, and so we're looking to move on those. And I don't know the conditions. Certainly, I'm not trying to issue any kind of level of defense. I do know that we have a number of people who receive outside or specialty care in the clinic outside of the facilities, and we've been having appointments canceled, like even some of the specialty care, just because of this. And I'm not saying that was the case here, but I just to let other people know that a lot of the clinics are canceling appointments that we've had set up for them.
Yep. Commissioner Schnell, I just, my work with Minnesota Adult and Teen Challenge, and I think I could speak on behalf of March as well, for people that are in under 180 days that have a treatment mandate that aren't going to get treatment while they're in. Looking at people being released. We have treatment beds that are available. A lot of treatment programs are staying open. We are doing intakes with some modifications for people that have other health conditions, but, would really look at being part of the conversation to get people directly out of facilities and into programs as an option.
Yes.
So if you're going to be having those conversations, looking at potentially releasing people, getting them into treatment, we want to be part of those conversations. So
I think, and that's great. And I think we did talk about this with both HRU, and then I asked our treatment folks to let me know the number of people who had CD directives that are sitting. I think right now, and again, I don't know what the numbers are, but I know that the bigger area where they're struggling is on the sex offender treatment side. But that's a great point. We'll make sure that happens. There has been a couple. Just so you know, we have received word from a couple of community treatment providers that they are not taking any new clients at all, and in some cases are saying, right now, we cannot meet the needs of new correctional clients, and I don't know. I think
we are not one of those.
No, I'm not. I'm not suggesting, and I know that you're not, but we have
in the wake of the opioid epidemic, we have a responsibility, and people are afraid right now, and I believe using more than ever. And our leadership team has made a different decision than that.
Okay. All right.
Just so you know.
Yeah, I appreciate that. Many other
Can I ask the person who just spoke to repeat their name and what organization they're with or department they're with?
Yep. Gina Evans, and I am with Second Chance Coalition, but I also work for Minnesota Adult and Teen Challenge.
Okay, thank you.
Hi, Sarah Edge from Minnesota Indian Women's Resource Center. With people entering facilities, inmates, are they being put into general population, or are they being separated from Gen Pop for a period of time?
It's a great question. So we just implemented that everybody will be going in through two places, obviously Shakopee and St. Cloud. That includes release violators, which was not always the case. Release violators would have gone back in most cases to the place they were last at. We are now moving people. Everyone will go in through St. Cloud. They will go through some level of kind of medical, more intensified medical screening when they come in. But they will also be kind of in a unit where they will be monitored for, I don't quote me on the number of days. There's so many different things going on here, but depending upon where they came from, so if somebody came from a jail and then we in some cases, we know what the practices in the jail were in terms of how they were managing people before they moved them to us. That might mean a difference. So they might be in more of that intake kind of hold and medical observation and outside of general population for a matter of 3 days or something like that. If we don't know or we can't, they came in from the community, they will go into. They will not be in general pop. They would be in units with about up to a 14-day kind of period where they would not be in general population, just to try and reduce risk of spread.
Yeah. Commissioner Snell, this is Sharon Brooks Green again. And speaking on behalf of families, most of us are ready to take our families home and to decrease the chance of spreading this disease within the prisons, as well as give our family members who are incarcerated an opportunity to survive.
Mm-hmm.
How close are you, and I know you said you're waiting on the report for the technical violators, who may be released first. And I know we spoke about closing some of the prisons before. How close are we to that, and how much can you utilize the families who are ready to take some people home today?
Well, it's release planning is going to be a part of that. I can't tell you what the status of the release plans are. I'm not close enough to know all of those questions. Plus, I think this is a departure from what has been history, and so I know that we've asked them to do that and make sure that we know where they're going to go. We have to. They have to go. The residence that they're going to has to be approved. That's in place, and so again, I think we want to expedite as much of that as we can. But I can't say we're going to be Monday or Tuesday. We're going to be releasing.
Right. What can we do on our end to assist you? If sending in addresses, or what can we do on our end, or is that part of a plan for us to be proactive?
I mean,
because the disease is so spreading so fast.
Yeah, I think one of the things is that as we look at the short term, the release violator stuff is a part of one of the things that we can do. We're even looking at things like moving some of our people that may have been doing other jobs into helping kind of work through some of these things, because we need to staff those things in order to do those reviews and all that kind of stuff. But the broader policy stuff here, I mean, the legal issues are, we're looking at some of these release violators, and I'm just going to be straight honest that some of them won't get released as a part of this if depending upon their what treatment directives they may have, and the history of risk and that kind of stuff. Those are going to be ones that we're not going to be looking. There's a whole lot of people that don't fall in that category, and those are the ones that I've asked HRU to get to me. But I think if we're looking for broader policy stuff, the hard part is it's a tough time. But I mean, I'm concerned. Will tell you that I'm concerned about the fact that we don't know what's going to happen with any of this stuff. We really need a pitch to the governor about broader scale things like trying to do community-based, really increasing a focus on community probation and community services that could be used to help address people's risk and needs. That's what we made some budget priorities. That we gave up. We committed to say that was a top priority, and I'm concerned right now, just to be totally frank, that we don't know if that's going to happen. And you know, we have certainly, there are politics, there are also economic realities for our state. But one of the things people can do is reach out to the legislators and say this is an important and critical issue, because it is some of the broad range of latitude here is statutory, and they need to make that investment that ultimately grows the ability of communities to respond to and address some of the needs that folks have.
Commissioner, this is Teresa Nelson from ACLU, and thank you for this call. I appreciate it. I have two questions. One is, if you could speak to the what your licensing division is doing to make sure that local jails are implementing sound public health practices, and then second is, you know, if there are any specific legislative proposals that you and the governor are going to be putting forward in the short term to the legislature for changes. I understand the courts are asking the legislature to make some changes to help them deal with this emergency, and so I'm wondering if there are specific things that you are seeking from the legislature right now. Thank you.
All right, thanks. So let me, on the jail stuff, we have been having, we did, last week, I think we did twice this week. We have conference calls with jail administrators, and we did one with sheriffs and the Sheriff's Association. We've talked to them about what we want to see and their plans, and most of them have. We used some of the jails to I'll just share this with you, give you some context of how we created our own nightmare here a little bit, but we tried to reduce some of our population so we could move folks around, right? If in the event of needing to kind of create some space and separate folks who had different types of conditions, and so we moved some people into the community, into some community jails. We're now, some of those jails are really saying, look, we're trying to do the same thing. We would like to have you take all these people back. And then we also have some construction projects going on in some of the facilities that make it such that we don't have the bed capacity. So we're working with a few of them, but I can say that in all the conversations we're having across the state administrators, that they are, that all of them have their plans, and the plans are being put in place. And we have directed that any that they notify the DOC immediately upon learning that they have a positive test result for COVID-19 in a month or within their population, and that they present to us their mitigation and response plan related to that. And so that's kind of what we know now. And then they're going to provide notifications to me beginning next week of any numbers of complaints that they may have related to COVID-19 issues or health related issues. The second part of that, we have been. This is a great question, because we have a whole bunch of things that we would like to do. We've had some level of resistance from some of the legislators saying, look, this is about, you have to establish, and you need to tell us, explain to us how things are an emergency. And while we may think that things are critical to be able to create space, safety, and because we're right now, I think, and what we've been saying is that we have to look at public health and public safety, community safety, as being both critical issues and not mutually exclusive. They are connected, and that's been one of our approaches. And so we have a number of priorities. Some of those things have been economic, just to try and address the COVID stuff, to make sure that both are on the community front as well as inside, that we have the ability to make sure, like, we would love to do things like free phone calls. We would love to do free visiting. Those are all part of our COVID package that we've submitted. And so they're out there, like a lot of this community-based stuff to be able to access nonprofits and other providers to be able to help support the transition of people back to the community, release violators or whatever they may be. There, we did ask for like there was $1 million+, $1.5 million, 1.8 million to be able to do things like that, because these are all things that we think would really help make those types of transitions important. And so they are working on that package. The governor's office and the Senate and the House are working on some of those things. What that's going to look like, we don't know yet. In terms of if they're going to do some floor sessions and take actions on these things, or if they're going to, we just don't know yet.
Well, I'm going to try and wrap things up here. We started late, but we've got over what we planned for half an hour. I just want to thank the commissioner for making this happen and everybody for your work. One thing I do want to say about, can somebody silence their phone?
You can mute your phone. It might be helpful over here. There's some feedback here.
For the conversation. Many of you know that I just started recently as the ombuds for corrections for the state. We don't have staff, don't have an office yet. So I wasn't planning to have a real public-facing component of the office, but now with this, I want to help as I'm, like a lot of people are doing, to step up and do what we can. I've created a Facebook page, and then also I have an email specific to this issue, and I can send it to the folks that were on the email and the initial invite. It's MNOBFC, like Ombuds for Corrections, abbreviated MNOBFC COVID-19 at gmail.com. And again, I'll send that out. But one reason I bring that up after your question about the jails, Teresa, is I do have jurisdiction over local jails and juvenile facilities. And what I'm finding on that right now is that just people are making it up as they go along, because they're doing it county by county. So if somebody's seeing some issue in some county, I can contact the sheriff, I can pull people together, give advice about what other places are doing. So if people want to use that resource,
great.
I welcome it. Yeah.
And I can just say one other thing too. We've also, I'm trying to find it. Here it is. On the website, we're going to, like I said, we're working on that video stuff. It'll probably be Monday before it gets done. But there is it's called DOC Community Info at state.mn.us, and it's on the DOC's website, the COVID page. It's kind of like resources or information for family and community members. And there's a book where we're going to load stuff and do frequently asked questions. As we get emails in through this email address, we're going to respond to them so people can see a response, and you can just start to track that stuff, because we want to make sure we're being responsive to family members. I just would say this. I know that we're all concerned about what this looks like, both for ourselves and certainly for our families and loved ones. I feel, a significant level of empathy for the people inside and the people that their family members. And so I just really would like to, I think to just say that we're mindful of that. And as we go through this, I'm happy to do more of these calls. And if Mark wants to set them up, we're happy to do that as well. So thank you for that.
Yeah, we welcome that. If there's questions about ICE detainees, who should I send those to?
If there are ICE-related questions, they can go in through that DOC community info, and you can put that right in there, and we'll get those addressed. We have somebody that's monitoring that, and we'll get the answers and put them back up.
Okay, thank you.
You bet. All right.
All right, thanks, everybody.
Thank you. Take care. Have a good weekend.
Thank you.
Thank you
all.
Thank you.